Welcome to your IELTS vocabulary practice. You'll hear 25 questions. Each question comes with 4 options. Take your time, pause whenever you like, and try to choose your answer before the correct one is shown. Enjoy your quiz. Question 1. What is the meaning of deduct? Option A. Divide a total to find equal portions. Option B. Add an amount to an existing total. Option C. Subtract an amount from a total. Option D. Multiply an amount to increase a total. Correct answer, option C. The correct meaning of deduct is subtract an amount from a total. Example: the accountant explained that eligible medical expenses could be deducted from the annual tax return to reduce the total owed. Question 2. What is the meaning of revert? Option A. Move forward to a new and different state. Option B. Return to a previous state or practice. Option C. Remain in the current state without any change. Option D. Observe a previous state without returning to it. Correct answer, option B. The correct meaning of revert is return to a previous state or practice. Example: without ongoing education and reinforcement, clinical staff can revert to outdated practices that compromise patient safety. Question 3. What is the meaning of thunderstorm? Option A. Warm, dry weather with strong gusting winds. Option B. Mild drizzle without any electrical activity. Option C. Storm with thunder, lightning, and heavy rain. Option D. Calm weather with light cloud cover. Correct answer, option C. The correct meaning of thunderstorm is storm with thunder, lightning, and heavy rain. Example: the outdoor health fair was moved indoors after a thunderstorm warning was issued for the region that afternoon. Question 4. What is the meaning of precedent? Option A. Random occurrence with no guiding relevance. Option B. Current event with no connection to the past. Option C. Future event used as a basis for current planning. Option D. Earlier event used as a guide for future action. Correct answer, option D. The correct meaning of precedent is earlier event used as a guide for future action. Example: the landmark case set a legal precedent that strengthened the rights of patients to make their own treatment decisions. Question 5. What is the meaning of remit? Option A. To receive payment or increase a debt. Option B. To evaluate a debt without deciding. Option C. To observe a payment without acting. Option D. To send payment or cancel a debt. Correct answer, option D. The correct meaning of remit is to send payment or cancel a debt. Example: the Health Foundation agreed to remit the outstanding balance for families who could not afford the clinic fees. Question 6. What is the meaning of tame? Option A. Moderately calm but occasionally unpredictable. Option B. Gentle and not dangerous or make less extreme. Option C. Briefly calm before quickly becoming difficult. Option D. Wild and unpredictable without any gentleness. Correct answer, option B. The correct meaning of tame is gentle and not dangerous or make less extreme. Example: the once overwhelming workload became more tame after the clinic introduced a new patient scheduling system. Question 7. What is the meaning of cultivation? Option A. Method of storing produce after collection. Option B. Process of preparing land or developing something. Option C. Act of harvesting a fully grown crop. Option D. Technique for transporting crops to market. Correct answer, option B. The correct meaning of cultivation is process of preparing land or developing something. Example: the cultivation of medicinal herbs in the community garden provided natural remedies while teaching residents about traditional plant knowledge. Question 8. What is the meaning of howl? Option A. A soft and quiet murmur of discomfort. Option B. A long and loud cry of pain or wind. Option C. A deep and resonant sound of approval. Option D. A bright and cheerful sound of greeting. Correct answer, option B. The correct meaning of howl is a long and loud cry of pain or wind. Example: the howl of the winter wind outside made the warmth of the community health center feel even more welcoming inside. Question 9. What is the meaning of persist? Option A. Pause temporarily before fully stopping. Option B. Continue to exist or happen over time. Option C. Stop and cease to continue at all. Option D. Occur only once without any continuation. Correct answer, option B. The correct meaning of persist is continue to exist or happen over time. Example: some side effects may persist for a few days after starting the new medication, but should resolve without intervention. Question 10. What is the meaning of confuse? Option A. Make something unclear or hard to understand. Option B. Explain something so that everyone understands. Option C. Present something in a clear and orderly way. Option D. Make something simpler and easier to grasp. Correct answer, option A. The correct meaning of confuse is make something unclear or hard to understand. Example: using too much technical language can confuse patients and prevent them from fully understanding their own health situation. Question 11. What is the meaning of religion? Option A. A system of academic study and research. Option B. A system of physical training and conditioning. Option C. A system of financial management and planning. Option D. A system of belief and spiritual practice. Correct answer, option D. The correct meaning of religion is a system of belief and spiritual practice. Example: many communities draw strength from their religion during times of health crisis, finding comfort in shared prayer and tradition. Question 12. What is the meaning of bear? Option A. Delay dealing with a challenging matter. Option B. Endure something or carry a heavy load. Option C. Transfer responsibility to another person. Option D. Avoid a difficult or unpleasant situation. Correct answer, option B. The correct meaning of bear is endure something or carry a heavy load. Example: she had to bear the long hours of preparation, knowing that the event would benefit the whole community. Question 13. What is the meaning of manifesto? Option A. Informal announcement made without formal planning. Option B. Verbal commitment with no written record. Option C. Public declaration of aims and intentions. Option D. Private note shared only with a small group. Correct answer, option C. The correct meaning of manifesto is public declaration of aims and intentions. Example: the health organization published a manifesto outlining its commitment to achieving equitable access to care for all communities. Question 14. What is the meaning of dock? Option A. Area where ships are stored between voyages. Option B. Platform where ships are loaded or unloaded. Option C. Open water where ships wait before entering port. Option D, covered shelter protecting ships from storms. Correct answer, option B. The correct meaning of dock is platform where ships are loaded or unloaded. Example: the supply boat pulled up to the dock and workers began unloading the crates of medical equipment onto the jetty. Question 15. What is the meaning of carrier? Option A, machine used to sort incoming parcels. Option B, person or thing transporting goods. Option C, vehicle used to distribute printed media. Option D, device used to store items temporarily. Correct answer, option B. The correct meaning of carrier is person or thing transporting goods. Example: the postal carrier delivered packages to every household on the street despite the heavy rain that morning. Question 16. What is the meaning of descendant? Option A, person who lived before a current individual. Option B, person unrelated to any historical family line. Option C, person related to an ancestor in later generations. Option D, person adopted into a family without blood ties. Correct answer, option C. The correct meaning of descendant is person related to an ancestor in later generations. Example: as a descendant of the village's founding healer, she felt a deep personal connection to her work in community health. Question 17. What is the meaning of impartial? Option A, changing position depending on the situation. Option B, treating all sides equally and fairly. Option C, strongly favoring one side over others. Option D, appearing neutral while favoring one side. Correct answer, option B. The correct meaning of impartial is treating all sides equally and fairly. Example: an impartial review of the health data allowed the committee to make decisions based on evidence rather than preference. Question 18. What is the meaning of buzz? Option A, deep rumbling sound from underground. Option B, low continuous humming sound. Option C, soft rhythmic tapping in the distance. Option D, sharp high-pitched ringing noise. Correct answer, option B. The correct meaning of buzz is low continuous humming sound. Example: the buzz of bees in the garden was a pleasant sign that the flowers were blooming and healthy. Question 19. What is the meaning of fluctuation? Option A, complete absence of any change. Option B, steady and consistent decrease downward. Option C, steady and consistent increase upward. Option D, irregular variation up and down. Correct answer, option D. The correct meaning of fluctuation is irregular variation up and down. Example: seasonal fluctuation in local food supply prompted the community to invest in better storage and preservation methods. Question 20. What is the meaning of versatile? Option A, able to perform only one specific function. Option B, inconsistently able to adapt depending on conditions. Option C, able to adapt to many different uses. Option D, able to adapt to a limited number of uses. Correct answer, option C. The correct meaning of versatile is able to adapt to many different uses. Example: a versatile community health worker who can address nutrition, mental health, and basic medical needs is an extraordinary asset. Question 21. What is the meaning of slam? Option A, to shut or hit loudly and forcefully. Option B, to evaluate without any movement. Option C, to open gently and carefully. Option D, to observe without any impact. Correct answer, option A. The correct meaning of slam is to shut or hit loudly and forcefully. Example: the door began to slam shut in the wind, and the nurse quickly caught it before it disturbed the resting patients nearby. Question 22. What is the meaning of furthermore? Option A, in contrast to what has been said. Option B, despite everything that has been said. Option C, as a result of what has been said. Option D, in addition to what has been said. Correct answer, option D. The correct meaning of furthermore is in addition to what has been said. Example: the program improved physical health, and furthermore, it created a stronger and more connected community spirit. Question 23. What is the meaning of souvenir? Option A, an object purchased for practical purposes. Option B, an object given as a formal payment. Option C, an object kept as a reminder of a place. Option D, an object created for immediate use. Correct answer, option C. The correct meaning of souvenir is an object kept as a reminder of a place. Example: she brought back a small handcrafted souvenir from her public health research trip as a reminder of the inspiring community. Question 24. What is the meaning of soar? Option A, to rise rapidly and impressively high. Option B, to drop rapidly and deeply low. Option C, to rise slowly and very gradually. Option D, to remain completely stable without chain. Correct answer, option A. The correct meaning of soar is to rise rapidly and impressively high. Example: community trust in the health program began to soar after residents saw real and tangible improvements in local services. Question 25. What is the meaning of pawn? Option A, person who holds great power in a situation. Option B, object of low value used as security or chess piece. Option C, item held permanently as a final settlement. Option D, object of the highest value in a collection. Correct answer, option B. The correct meaning of pawn is object of low value, used as security or chess piece. Example: she felt used as a pawn in the administrative dispute rather than as a professional whose expertise should be valued. This is the end of part 89. See you in the next quiz.